Hi, I'm Kylie, and in today's video, we're covering antiarrhythmic agents, a key topic for NCLEX, clinical practice, and med-surg success. We'll break it down using a clear rubric: classification, action, meds, side effects, nursing tips, and patient teaching. Let's get started. Antiarrhythmics are medications that help correct abnormal heart rhythms. The Vaughan Williams classification divides them into 4 classes. The first class is sodium channel blockers. The second class is beta blockers. The third class is potassium channel blockers. And the fourth class is calcium channel blockers. There is technically a class 5, and that's a miscellaneous, and that goes with adenosine and digoxin. Each class affects a different phase of the cardiac action potential. Here's how each class works. So class 1 slows depolarization by blocking sodium channels. Class 2 slows heart rate and AV node conduction via beta antiarrhythmic blockage. And class 3 delays repolarization by blocking potassium channels. And class 4 works through other mechanisms like resetting the AV node or increasing vagal tone. So common medications for class 1 would be lidocaine. Class 2 is propranolol. Class 3 is amiodarone, and class 4 is verapamil. So for class 1, you'd see that more for ventricular arrhythmias. Class 2, you would see more for AFib or AFlutter. Class 3 would be for AFib or VTAC. Class 4 would be for supraventricular tachycardia and rate control. There's also class 5 that I kind of talked about, which is miscellaneous, but adenosine and digoxin. And adenosine is for PSVT, and digoxin is for AFib with indications. So you would need to watch out for these side effects and red flags. For class 1, it would be CNS toxicity, hypotension, new or worsened arrhythmias. Class 2 would be bradycardia, fatigue, hypotension, bronchospasms, especially in asthma patients. Class 3 would be pulmonary fibrosis, liver toxicity, thyroid dysfunction, and photosensitivity. And class 4 would be bradycardia, constipation, and peripheral edema. For the class 5 would be adenosine. You would get asystole, chest pain, and flushing. For digoxin, you would need to watch out for digoxin toxicity signs, which include nausea, visual changes like halos, and bradycardia. So as a nurse, here's what you need to do when administering antiarrhythmics. You want to monitor heart rate, rhythm, and ECG. Check electrolytes, especially potassium and magnesium. With amiodarone, you want to monitor thyroid, liver, and lung function. For digoxin, you want to assess apical pulse for a full minute and hold it if it's less than 60 beats per minute. And when giving adenosine, warn the patient that they may feel like their heart stops briefly, and that is totally normal. Educate your patient on these safety tips. Report chest pain, dizziness or palpitations. Avoid grape juice with calcium channel blockers. Wear sunscreen with amiodarone due to photosensitivity. No signs of digoxin toxicity, yellow and green vision or halos, nausea and confusion, and never abruptly stop beta blockers. These may cause rebound tachycardia or hypertension. Here's a quick recap using the mnemonic Some block potassium channels. So the S standing for sodium, which is your class 1. B standing for beta blockers, that's your class 2. P, potassium, class 3. And C, calcium, your class 4. So some block potassium channels. And don't forget, there is kind of a class 5 miscellaneous of adenosine and digoxin. Antiarrhythmics save lives but require care and monitoring. Know your classes, stay alert for side effects, and always educate your patients. Thanks for watching.